Neurology Quiz number 13. What is juvenile myoclonic epilepsy or JME? JME is a generalized epilepsy, also known as Jan's syndrome, and is characterized by occurrence of myoclonic, generalized tonic-clonic, and absence seizures. It usually manifests between 12 to 18 years of age, affects both sexes equally, and is one of the most common childhood/juvenile epilepsy syndromes. It accounts for 5 to 10% of all epilepsy cases. Family history may be present in 30 to 50% of cases. Gene mutations noted in some patients have involved GABRA1, which encodes the GABA receptor subunit, CACNB4, which encodes calcium channel subunit, and EFHC1, which encodes the myoclonic gene. All patients have myoclonic seizures. 85 to 90% have generalized tonic-clonic seizures, and 20 to 40% have absence seizures. Absence seizures, when present, are usually the first to occur, followed later by myoclonic and generalized tonic-clonic seizures. Seizures, especially myoclonus, tend to occur 30 to 60 minutes after awakening. Seizure triggers include sleep deprivation, alcohol intake, emotional stress, and fatigue. 30 to 40% of patients may exhibit photosensitivity. Interictal EEG typically shows diffuse, symmetric, bilateral 4 to 6 Hz polyspike and wave discharges with a frontocentral predominance. JME is relatively easy to control with anti-epileptic drugs, but requires lifelong treatment because of high chances of relapse with AED discontinuation. Sodium valproate, a broad-spectrum AED, is one of the drugs of choice. Other options include levetiracetam, lamotrigine, topiramate, and zonisamide. Lamotrigine may exacerbate myoclonic seizures. Carbamazepine, oxcarbazepine, and dilantin are contraindicated as they can worsen myoclonic and absence seizures. What are the gepants used for abortive treatment of migraine? Gepants are a new class of migraine medications for abortive treatment of migraine. They are CGRP receptor antagonists. Gepants are small molecules, unlike the monoclonal antibodies such as erenumab, which are used for migraine prophylaxis and which are large molecules. Unlike the triptans, gepants do not cause vasoconstriction and therefore could be used in patients with vascular disease, heart disease, or stroke. They are not associated with medication overuse headaches. There are currently 4 gepants, 2 of which are available as tablets for abortive treatment of migraine. These are ubrogepant. The dose is 50 to 100 milligrams POPRN, can repeat 1 hour later for a maximum of 200 milligrams per 24 hours. Common side effects are drowsiness, nausea, and dry mouth. Rimegepant ODT. The dose is 75 milligrams POPRN. Common side effects are nausea. Rare side effects are hypersensitivity reactions and skin rash. Of note, this medication was approved by the FDA in May 2021 for migraine prophylaxis as well. The dose is 75 milligrams every other day. Verzagepant, a gepant nasal spray, is in development for acute migraine treatment and not yet available. Atogepant is being studied exclusively for migraine prevention in a daily dose. As a class, gepants provide lesser likelihood of acute pain relief at 2 hours than triptans and ditans such as lasmiditan, but are better tolerated and have fewer side effects. Data on whether gepants can be used as abortive treatment in patients who are on monoclonal antibodies for migraine prophylaxis, which also target CGRP such as erenumab, are limited. However, case reports suggest no untoward reactions from this combination. What are the neurological complications of herpes simplex virus 2 infection? HSV2 infection is usually acquired through genital contact. It lies latent in the sacral dorsal root ganglia, and latency has also been demonstrated in the trigeminal ganglion. CNS complications include acute aseptic meningitis. It can also cause recurrent aseptic meningitis, and these cases were previously misdiagnosed as Mollaret's meningitis. Encephalitis and ascending myelitis can occur, more commonly in the immunocompromised. Neonatal herpes simplex encephalitis is a devastating disorder seen in infants born to mothers with genital herpes. In addition to encephalitis, infants have involvement of eyes and skin. Disseminated disease can occur with involvement of liver, lungs, and DIC. It carries a high mortality. Lumbosacral radiculopathy can present acutely with radicular pain, paresthesias, urinary retention, and leg weakness. MRI may show nerve root enlargement, hyperintensity, and enhancement. This condition is also called Ellsberg syndrome. Workup for these different entities includes MRI of the brain and spine, CSF examination, EEG, etc. Acyclovir is the treatment of choice.